Hi, everybody. My name is Kelly Lyons. I'm one of the nurse practitioners with the Bone Marrow Transplant Department, and I'm here to talk to you today about what a typical clinic day is like. So congratulations. You've likely finished your inpatient stay if you're getting up to this point, and your child has gone through the chemotherapy, the cellular therapy infusion, and the inpatient team feels like you are ready to go home, either to Ronald McDonald House, which is a place where you can stay if your home is too far away, or your actual home. Even though you are discharged from the hospital, your transplant journey does continue still outpatient. And your child is likely feeling a lot better than they were immediately post-chemo, but they're still recovering from complications from transplant, and our team is still monitoring for the success of the infusion and the treatment. So for most of our patients, we ask that they come to clinic 2 to 3 times for 100 days following their transplant. So if you can kind of put this together, most patients are discharged around day plus 30, so 30 days after their cells. So for 2 months, you are coming 2 to 3 times a week to our clinic. So though that time can be very busy for you. Now, the reason that you come is even though that you're feeling a lot better, you remain very immunocompromised and you're still recovering from some of the treatment side effects from the chemotherapy and the cells. In addition, it provides a great forum for us to support you for any questions on medications, side effects, treatments, etc. Most visits during this time, early after the hospital admission, can be longer visits, up to 2 hours, if not a little bit longer. The reason why they're a little bit longer in the beginning is because you're close to the treatment and your counts are still recovering, and you may need more interventions from our nursing team in clinic. Most common is monitoring for the need for blood transfusions or seeing extra consults. So what does a clinic visit look during this time? So you'll come to the 4th floor. We are on the opposite side of the inpatient unit as part of the Centers for Cancers and Blood Disorders, CCBD clinic. But the BMT clinic is at the back, and we are 5 rooms, and then we have our own staff and nursing as well. You'll come to the clinic and you will get intaked. And what that means is the nurse will greet you. You'll get a height, a weight, and a vital signs. So we know how your blood pressure, temperature, etc. are doing. After you get intaked, you will get your labs drawn. If your child still has a central line, it will be drawn through the central line. If it's later out from transplant and that central line is no longer in place, you will go to our phlebotomy station where a tech will draw your labs peripherally with a poke. Now, everyone's labs are different in clinic, but most commonly, the labs that will be collected during this time are blood counts, like checking to see how your white count, hemoglobin, and platelets are doing, looking at your liver and kidney function, looking for certain infections, drug levels, and then any other disease surveillance if related to underlying sickle cell disease, leukemia, or graft function. Once you have your labs drawn, at the vast majority of visits, you will then see a provider. For most of the visits, we make an attempt for your child to see a member of your primary team. So either the doctor or nurse practitioner that you first met during consultation that has been along with you on this journey. If that provider isn't available during that clinic visit, we have a small team of other doctors and nurse practitioners that practice in our outpatient clinic that you'll see during this time. The reason for the provider visit is really just a forum to see if you guys have any questions, any concerns. It also gives us an opportunity to ask questions, since we don't have you inpatient anymore with nursing monitoring, to see how you're doing to screen for infection, graft-versus-host disease, and nutritional complications. Common questions that you may hear us talk about during these visits are asking how the general energy and appetite are doing, screening for any new rashes, URI symptoms such as coughing, sneezing, diarrhea, and just how doing at home mentally and emotionally as well. As your child is further out from transplant, we move from the very frequent schedule of 2 to 3 days a week, slowly to once a week, gently to every other week, and the goal is by 6 months to get to once a month visits. Now, this is a very general guideline, and of course the visits are tailored to your child's needs, but that's the overall goal, is to get to once a month by 6 months, and then you continue monthly visits at a minimum until 1 year. At 1 year, you enter a new part of the transplant journey called long-term follow-up, where we will see you at least once a year to just make sure everything is still going good with the transplant, looking for late effects of chemotherapy, and bridging care with your primary care. All right, well, that's what a typical clinic day is like in BMT. I look forward to working with you and your family, and thanks for listening today. Bye.